serving evangelists and candidates. This area was seen as one of the low-lying fruits. Business committee emphasized succession planning, capacity building, and the equitable regional representation in endeavors of training and development committee. Special matters held by the business during the year under review are shown there. Of course, we remember with the sorrow and gratitude to God the issue related to the demise of the spouse of our moderator, the special meetings, planning the special GAC, and the implementing issues related to the first GAC, property development and oversight. The issue of Milere continues to be an issue under discussion in the business. The issue of Arusha town plot that has been acquired and now fenced. The issue of Uganda, growth and partnership milestones that have been made during the year under review are shown there in the report. The issue of the centennial celebration was prepared and now is behind us. The issue of the support through global ministries to Nanyuki Academy with the figure shown there. The business committee also oversaw issues related to demise of ministers, and some of the ministers that have left us are shown there. The business committee was involved in the process, their final days and burial. And I want to invite the Secretary General to do the conclusion as he seconds the report. Secretary General.
The clerks of the Assembly commend the members of the Business Committee, all the subcommittees, the General Assembly Office, and regional representatives for their dedication and sacrificial service. It is our prayer that the Lord will continue to grant wisdom and grace as the Church faithfully pursues its calling to serve the Lord. So with that conclusion,
Looking for a serene, affordable getaway in Mombasa? Welcome to Waget Hotel, a PCEA-owned destination where comfort meets value. Whether you're an individual, a family, or a group, Waget Hotel offers the perfect setting for rest, bonding, and fellowship. Enjoy our exclusive off-peak rates for PCEA church groups at just 2,500 shillings per person on half-board and 2,800 shillings per person on full board, inclusive of a complimentary conference hall. At Waget Hotel, we go further with special discounts, flexible packages, and rates designed with your convenience in mind. Experience genuine hospitality in a quiet, serene environment, the perfect place to relax, connect, and create lasting memories with your family and team. For reservations, call 0722 209 796 or WhatsApp 0731 209 796.
Okay, that's why I advised that let all details be included so that there is no confusion as to who did what. If it is ECHO that directed us to global ministries, let it be said so that everybody gets their credit, because these are documents that will be read in the years to come. Okay, are there any comments now that we have had the questions? Any comments, Reverend Mugai?
Sorry, Moderator, it's a question on number 5 that we had recruitment of long-serving evangelists and those who have completed theological trainings. It's about the long-serving evangelist. So I don't know when we did this, the recruitment of long-serving evangelists.
I guess that does not necessarily fall there. Maybe there is a statement about it, but I guess maybe in the training report, it would appear there. So remember, if it appears, but maybe from where I sit, I know it hasn't been concluded yet. It's work in progress. And Rabulia, you had your hand up?
Mine also got the training.
Okay, so thank you. Any comment? Okay, there being no comments, this is very good for us. We are going to move at that pace. Much as discussions are good anyway because they grow us. But again, when it comes to redeeming time, you would want a very passive when it comes to redeeming time. But again, when you want quality, I want you mchangamuke kidogo. Watu wa Mungu. I have seen a hard.
Mine is to appreciate the effort that Nanyuke we received this month, and it is working. Whether it is from WICO or from Global, the money is working. Thank you.
Did we get our 10%? Because if it came through us, we were entitled to a 10% administration or 5% whatever. That the finance committee will tell us. If we processed the money, then maybe we needed some administrative advantages. Any other comment? I don't see any other hand. Then we will move on to the resolutions.
Thank you, Moderator. Resolutions for the document 3. This GAC receives the report of the clerks of the Assembly with thanks to God.
Taken.
This GAC expresses its gratitude to the 24th General Assembly officials for their leadership provided to the Business Committee throughout 2025.
Taken.
This GAC thanks the Business Committee for its diligent oversight in the 9 meetings held this year, noting their commitment.
Taken.
This GAC extends its sincere appreciation to all subcommittees, the Audit and the Risk Committee, and all the committees listed there for their technical expertise and the progress reports.
Taken.
This GAC recommends strengthening of international mission partnership.
Taken. Yes. Yes, here.
Thank you, Moderator. Accommodation. we need to have, or rather to understand what international mission partnerships, because we cannot just allow partnerships with all the international missions. It is good that we deal with each mission partnership by its own and on its own merit, not leave it as open as it is. And saying that, moderator, I am also understanding that we have asked questions in the report that that we were supposed to discuss yesterday, of the Secretary General, the issue of ECO. So ECO is being mentioned here, and if you ask many of us, we don't even understand, because it was supposed to be discussed before we can come to the work that the ECO is doing. Not that I'm saying that it is bad, but if we leave it as open as that, who will be bringing this international mission partnership?
What would you recommend? How do we make it better?
That before as we recommend the strengthening of international mission partnerships, they should be approved by the business committee.
Yeah, I think that is in order. That every partnership we want to get into must be studied. We can't just walk in blindly. We may get ourselves into trouble. So every partnership we get into need to be audited. And in many cases, the GAC shouldn't recommend. It should instruct. So I guess we are talking about any future partnerships. The business committee should undertake a study before committing the charge. I'm trying to look for those words that will make this resolution have some teeth. Because we appreciate the resolution, the spirit of the resolution is that we will enter into partnerships in days ahead. How do we go into it? It is through the business committee having done a study of them and understanding them. Can you get me the right words for that? I have given you the skeleton. Bonagatu wants to assist.
Thank you, moderator. I want to suggest that it reads like this. This GAC appreciates the partnerships and formation of partnerships for strengthening of a mission, and directs the business committee to evaluate all such partnerships to ensure that they align to our mission.
Okay, we appreciate the ones that are already there because they must have been studied. But now going forward, the business committee undertakes to study them. Is that okay?
That is okay, moderator.
Okay, then give him a place to write what he has just said and get a seconder for that. Get an elder to second that. Proceed.
This GAC recommends that the Training and Development Committee continues to prioritize inclusive ministry by supporting students with special needs and intensifies mission training recruitment for Tanzania and the Uganda mission fields.
Would this come here, or maybe it can go to
training?
To the training. Okay, you just lift it. We'll keep it somewhere to remember it. Thanks. Next.
This GAC receives with thanks to God the subdivision of Karuthi Parish in Githongori Presbytery, Nanyuki Parish in Nanyuki Presbytery, Maera Parish in Nyandaro Presbytery, aimed at enhancing pastoral effectiveness.
Nairobi North, were there subdivisions around the same time? Yes. Kiukeda, Kahawa Farmers?
Yeah.
Vika, is it part of it? No. Vika happened later? Happened earlier. Okay, maybe include the one on...
Okay.
But is there reason? Yes, Bwana Karanja?
Moderator, sometimes I get lost on a resolution, because a resolution is like a policy you're trying to make that takes us ahead. This is like a Thanksgiving. This is like it's a report, because it's already in the report and it is done. We don't need it as a resolution because it's already in the report and it's captured. Because the resolution is like the way forward. You're looking for a policy. This is the resolution of the church from today henceforth. Will be coming to this GAC without shirts. So otherwise, this is the work that has been done. So for me, moderator is not a resolution because it's already in the report. It's work that has already been done. Thank you.
So do we drop it? Okay, next one.
This GAC approves the opening of the NSSF Tier 2 account under the Staff Retirement Benefit Scheme with the designated General Assembly officials and Pension Department signatories.
Taken? Taken?
This GAC thanks the Church for the unity shown in supporting the moderator's family following the loss of Mrs. Winnie Wajiru Thegu.
Okay. And the moderator thanked the church. So we drop it. Thank you. I had thanked the church for the support that you gave us all the way. Thank you. Although the business committee was right at the center, we appreciate that. Okay. Any additional? Reverend Doria?
Thank you, moderator. I would want to add a resolution arising from the report where we were told about the forensic audit, and we probably develop a resolution to say that this GAC directs that the forensic audit report be expedited and submitted and acted upon without delay.
Taken? 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 Yes, no? We take it as, yes? Dr. Karimi? Or you had raised your hand? I thought you had during the mic.
Thank you, moderator. I think these are some of the things that are coming because we as an assembly omitted the report of the Secretary General. It was covered there.
You are guided. You do not talk about matters that have not been deliberated by the GAC. Talk about what is on the table.
And moderator, thank you for the guidance. But if we go by that, we will be repeating a resolution that was in the report of the Secretary General.
You are guided again. We are handling this report.
Thank you, moderator.
What was said, was it in the report? Because what there is any resolution related to this document must relate to it. If it is not in the report, then we can't handle it. So you can't take us to another report.
Thank you, moderator. Further on this, the issue of the audit, forensic audit, is an active matter in the business committee. I will want to indulge your wisdom whether it is prudent for us to have a resolution on an active matter in a particular committee.
Okay. I guess the issue is it is an active matter. So we appreciate that, even without a resolution. That it is an active matter, yes. And that must sink into us. That it is a matter that is still alive. It has not been concluded. So we need not maybe, although he was talking about hastening them, telling them to expedite. They have heard. Those who are here and are members of that committee have heard that they should not tarry. They should expedite that process. I think that serves it. Any other additional? No other additional. So we are done. We have done and dusted that report. Thank you. Take back your positions. Okay, next order.
The next item is the report of the Health Board.
Health Board, they have a chair, they have a secretary, and a big, big family. Where will they sit? Of course, only the chair and maybe the secretary would find seats here. The rest can.
We ask all the members of the Health Board to come.
The 3 hospitals?
Yes, the hospitals, sir. So you can get for us anybody who is outside, because tell them the health report is being done.
Are you ready?
Moderator, I would wish to say that Chagoria Hospital is here, Tomotomo Hospital is here, Kikuyu Hospital we have the chair, we don't have the CEO. And monitor, we have a baby as at the health board called Rumuruti. Yeah, we have a baby at our chair is here. Monitor, we will do this report, all of us. I will do a little of the overview of the health board, and then we will have some 2 minutes each for our hospitals. Yes, to make some summary of what we have in the health board. Okay. We have the report of the health board to the second GAC of the 24th General Assembly. The health board services provide strategic oversight and coordination of all PCEA health institutions, including hospitals, health centers, and training facilities, while ensuring proper infrastructure and medical equipment for quality and sustainable care. In 2025, despite financial and resource challenges, the board achieved notable growth across mission hospitals, medical schools, and the HIV and drugs control desk, expanding services and strengthening capacity. Key focus areas included accessible and affordable health care, mental health awareness, and the prevention of alcohol and substance abuse, alongside support initiatives such as AA groups. These efforts reflect the church's mission to demonstrate the love of Jesus Christ through compassionate, holistic care that promotes both the physical and the spiritual well-being. The composition of this committee is the chair and the CEO of all our hospital and the director drugs control desk, which is under the office of the Deputy Secretary General. We had 3 meetings. We had subcommittees to support us in work, as shown. We had activities of the year, included the Health Week on the theme Break the Barrier, Restore the Board. And we had several activities during Health Week. And we had the culmination on Sunday 12th at Rumuruti, where we did the commissioning of the PCEA Rumuruti Hospital, marking it our 4th national hospital as health board. We did medical checkup for the PCEA office staff and all the ministers. We did training on Alcoholics Anonymous, our effort to bring and rehabilitate those of our family and the society that have been affected by addiction. The schedule of how we did our medical camp and the entities that supported us, including Nakuru West, GAC Insurance, Kikuyu Hospital, Tomotomo Hospital, Chogoria Hospital, Medical Scheme, and the Midele Hotel were our partners in this journey. And we had several achievements shown there. And one of our greatest achievements nationally was the commissioning of PCEA Rumuruti Hospital. And the progress is notable, and we want to continue in our fight at the national level to bring on board with a lot of love people affected by alcoholism. Definitely we had several challenges. I know our hospital CEOs will highlight them, arising from the matters we know are SHA, and that is a big challenge that we have. We have some recommendations and our future plan as the health board, and we want to assure the entire church. We are committed as health board to ensure that we take care of our hospitals, that we ensure that it's good running of those hospitals, that we ensure that we are outreaching and we are even expanding, as I have already noted. The demand for health care services definitely is rising, and the health board is concerned and committed to ensuring the same. We continue to do a lot of training through part of our partners, and especially MBF. Our CEO and the leadership of our hospitals have continued to receive a lot of training from the MBF, and they are equipped for service. I want to, at this time, bring on board first Chogoria Hospital, so that the CEO can have his 2 minutes, and then the CEO Tumutumu will follow, then the CEO Kikuyu Hospital, and then the director drugs desk will come. The presentation will be run from there. IT? Olida? We have some very few, like 2 slides for each one of them. Olinda? Getao, you have them? Slides from our hospitals. We start with Kikuyu. We can jump Kikuyu before the CEO comes in. Tumutumu. Karibu Tumutumu CEO. And then after Tumutumu? Chagori, okay.
Thank you, Moderator Sir, and the church leadership and commissioners, delegates. Praise the name of the living God. My name is Kinyo Mkindia, the CEO, PCA Tumutumu Hospital, and the board secretary. Looking for the slides.
Looks like you need to have your own.
Yes.
Because the commissioners have their dockets. So they don't need this one.
I have my summary.
Looks like it's you who does not have it.
I have my summary. Let me proceed, moderator, with your permission, sir. Thank you. Members, this is the brief report touching on PCA Tumutumu Hospital, the performance for the year under review. We begin with the chaplaincy, and these are the highlights. Moderator Sir, between June 2025 and July 2025, we are starting training for all members of during the Health Week. The committee visited several churches, starting sharing the word of God that is within the region, and of course the presbyteries which are within the reach. We also organized a fundraising of 12 students buy musical instruments, which was done on 28 August 2025. The patient spiritual ministry, the patient spiritual care carried out in the entire year, including praying with grieving families. Bible studies and spiritual formation sessions were started, and they are still ongoing. We have Guza Mtu initiative, a charitable initiative started and being resourced by members of staff. The activities here include visiting selected believing families, prisoners, and families going through disasters, like those maybe who have problems, maybe those whose houses get fire. The board is considering to recruit an evangelist with the help of the presbytery, of course getting funding from, we are hoping to get funding from partners. Briefly, I will go through the clinical services. During the year under review, Moderator Sir, if we compare 3 years, 2023, 2024, 2025, we have highlighted how the performance was. I think I'm faster than the person who is presenting.
follow your own order.
Okay, fine, thank you. Comparing the 3 years, moderator, 2023, the total outpatient attendance was 75,964. 2024 was 72,743. And there was a huge decline in 2025 because this is when we are transiting from NHIF to SHIF. Then we earned the inpatient admissions, again, 4,127 for 2023. The numbers increased to 4,479 in 2024, and the numbers slightly increased, the numbers almost the same in 2025. For operations, we have a summary. The total for the year of 2023 was 1120, the year followed 1183, and 2025, 1369. Total deliveries, 741, 822, 709. Antenatal clinic, 2226 for year 2023, 2413 for year 2024, 1,908 for year 2025. And we realize the numbers are not high because of the transition from NHIF to SHIF. And then we also have physio laboratory imaging. Maybe I mentioned imaging. Imaging, we earned a total of 6,760 in 2023. The numbers increased to 7,365 in 2024, and they still increased in 2025 to 7,795. Then we have dialysis. The numbers are given. So for the special consultant clinics, the total for year 2023 was 13,119. The year which followed, 13,045, and then year 2025, 7,425. Human resource establishment. Monitor said we have been quite conservative all the years because we are keen not to bloat the staffing. However, we realized that there were marginal increases on staffing because of additional services. For example, in 2023, we have listed numbers as the establishment as per departments, administration, finance, nursing, clinical, and then the total. In 2023, the college and total members of staff were 22. 2024, they were 25, and 2025, they were 29. The hospital, and 185 in 2023, 260 in 2024, and 226. In 2024 they were 200, and then 2025 they were 226. And then the number of locums, these are the ones who come to bridge shortages before maybe we replace members of staff. Financial performance. Moderator said that we again compare the 3 years. The total revenue for year 2023 was 444 million. The year which followed, 449,000, a marginal increment of around 5 million. And then in 2025, we saw the jump from 449 to 555, which was approximately 100 million Kenya shillings. Total cost of sales on direct costs for 2023, 160 million. 2024, 170 million, and for 2025, it jumped to 233 million Kenya shillings. Then we had net income is given, staff costs, 2023, 167 million, the year which followed, 125 million, and 2025, 197 million. Administrative expenses, this is why we're trying to bring them down. For 2023, they were 65 million. 2024, they were 81 million. And in 2025, the total cost for administrative expenses went down to 77 million, a decline of around 4 million Kenya shillings. Total operational expenses, it is given. In the interest of time, I move faster. The net surplus before provisions and depreciation. For year 2023, it was 47 million. 2024, it was 2 million. And then this is when maybe we're in shocks when we are moving from NHIF to SHIF. And now we have been able to recapture our ground in 2025 because the surplus before provisions was 43 million Kenya shillings. Then we are in provision for doubtful debt, mainly because of the uncertainty of getting reimbursed by SHA and the defunct NHIF. We had to increase provisions. In 2023, the provisions were 19 million. In 2024, a marginal increment to 20 million. But in 2025 rather, the provisions increased to 36 million Kenya shillings. Then we have the surplus after provisions and depreciation. In 2023, it was 28 million. In 2024, we had a deficit of 17 million. But in 2025, we have registered a surplus of 7 million. What we intend to do, monitor sales, so that we can spur that growth, we have proposed revenue drivers. One of them is mounting of oncology unit. We want to roll out the diploma in clinical medicine and surgery, possibly September this year. We also want to roll out iron diploma in clinical care nursing, possibly by September this year. And then we are waiting we have two satellite centers, the Karatina Medical Center and Tumotomo Health Center, which are awaiting accreditation. Most of the work has been covered in ultrasound. And then we want to make our lab services almost a 1 year service center. Thank you so much, Moderator.
That must have been more than 2 minutes.
Oh, sorry.
Okay. Tomo can go next. Sorry, Chagoria? Okay.
Thank you, Moderator. My name is Dr. Elijah Maura, CEO and Secretary to the Board of PCH Chagoria Hospital. So there is a 16-page docket in the docket report. So mine is essentially to give you a summary of the salient points in that report. So for the year 2025, the hospital has demonstrated growth and strategic transformation.
That is after collapse or decline of support from the US for HIV care. We have integrated that care with chronic disease care through the public health clinic. Our college has grown to current population of 523, and then in the same year we completed the modern academic and clinical infrastructure. Is that the next stage? Yeah. So we have also had the proven performance and accountability. We sustain financial growth. If you see financially, our income, our revenue grew to 852 from the previous of less than that, and our taxable income came to around 6.3 million. Now, I want to say a few things about tax exemption, which is one thing that we really need requires Chagoria Hospital. The fact of the matter is that our revenue has grown, but it has not been reflected by cash flow. So, in short, for example, we have about 300 million, which is held by SHA and by NHIF, which is not come through to the hospital. So, the surplus that we make is actually not in cash. It is held by these organizations. So we really need tax exemption moving forward. Some of the things that allowed us to have a taxable revenue of 6 million is because we had some provisions that we applied this year, which might not be available to us next year. Next slide. So for 2026, our priorities are, we have acquired a new CT scanner, 128 slice G scanner, that is currently under installation, and we are keen on having it operationalized by next week.
We are also expanding our cancer care. It has really grown and we wish to expand it. And we intend to have continuous infrastructural improvements. So to the GAC, I think I would like to make you aware that every year we have that Walk for Hope, the second picture you see there. That's usually the first Friday of October. I think as members of the church, if you want to support cancer care at PCH Warrior Hospital, you are very much welcome to contribute by your presence or in kind for that support. Thank you very much. God bless you.
Okay, thank you. Kikuyu.
Thank you, moderator, sir. I'll also do very high level presentation. I'll start with our chaplaincy department. The chaplaincy section continues to offer spiritual nourishment to our staff, our clients, and School of Nursing students. And some of the key highlights in the period under review are spiritual ministry implementation program, the Heart of Chaplain training, mobility clinic. We had a debrief retreat organized by WAPE in Nakuru. We also have program for children, that is children ministry. We have had several workshops, retreats, and conferences. We have a new chaplain, and we have the saline process training that trains our staff to be the salt and the light and witnesses of Christ. We had a retirement service for our long-serving chaplain, Reverend Kaboi, in December last year. We also have weekly chapel services, monthly prayer fellowship, monthly service for the School of Nursing. In terms of financial performance, the year under review, we recorded 45.4 million compared to 41.1 million last year, which is a 10% growth. Then in terms of our human resource, the focus during the year was to strengthen our institutional capacity, compliance with quality standards, leadership development, clinical governance, patient safety, and continuous professional development across all departments. Our School of Nursing, currently we have a total of 657 students, composed of 271 nursing students, 171 HCAs, 200 perioperative theater technology students, and community health students are 15. In terms of quality management, moderators, I want to mention that until last year, July, we were under ISO 9001-2015 standards, but now we've dropped that. We've embarked on safe care, and we are currently at level 3. There are normally 5 levels. Under medical, we have new medical services, new radiology services, new innovative urology. We have cardiology services. We have dermatology. We currently have consultant anesthesiologists onboarded. We have a second gynecologist onboarded, and we have interventional radiologists on board. Currently, moderators, we have 48 medical specialists across various disciplines. And if you interact with our report, you'll see the clinical statistics with graphical presentations for ease of reference. And outreach, during this period, a total of 79 outreaches were carried out, and 12,920 clients were screened, with 2,507 clients referred for further management. And a comprehensive care clinic, we are transitioning in HIV care from donor dependence for self-sustainability. We all know what happened with America when the donor funding was affected. We take care of 2,299 and 149 HIV and TB clients respectively. Major achievements: we procured the state-of-the-art modern hospital equipments. We are currently constructing a 180-bed new hospital building. It's a 4-story building. Currently, we are on 3rd floor from basement floor. We have trained 40 customer care champions. We've introduced a QR code to assist customers to give us feedback. And we've expanded our hospital entrance out there. And then our eye unit now has been revamped with Terrazzo Works. Future plans, you can interact with the strategic plan 2023-28. You'll see what we are planning to do. Under development partners, we have quite a number. We have Ministry of Health, Central, national government, county government, GAC, CDC, CBM, challenges, staff turnover, cash flow, lack of tax exemption, certificates, but we are working towards mitigating this challenge. And lastly, we want to thank the church, the board of management, the staff, for the support that they continue to offer to this great institution. Thank you, moderator, sir.
Okay, thank you, Drugs Desk Director.
Thank you. I'm going to give a short report on the drug desk, and I want to say that the year under review, we had various campaigns against alcohol and drug abuse, where we interacted with schools, targeting millennial, Gen Z, and Alpha generations through various ways and modern means of communication. The PCA Drugs Day was observed on the 22nd of June, 2025. The World Drug Day was observed also on June 26th. It was celebrated all over our country, our church, and in the world. During the Health Week, the drug desk worked in collaboration with our mission hospitals, GAC TV, PCA churches to celebrate Health Week. Counseling services and psychosocial support. The drug desk has been offering counseling services and psychosocial support to affected families in the church and communities, and effective counseling programs to recovering addicts and their families was also undertaken. 5 seminars and training. The drug desk conducted seminars and training successfully in churches and various institutions of learning. Mentorship. The drug desk regularly conducted mentorship of children, youth, and equip parents and teachers in churches and schools with appropriate tasks and skills for their service. When we had the rite of passage for both girls and boys, we participated in various parishes and congregations, and we created an awareness on various types of addiction and talked about sexual purity among teens and youth. We are still going to have these same activities, the Drugs Awareness Day and the World Drug Day, and we will continue even with the World AIDS Day. And also we are working with various parishes and congregations to continue seminars and also continue with the counseling programs. And we are also working with the elders who are coming to the retraining and the evangelists and training them on various ways of dealing with this issue. With that, I finish.
Okay, thank you, Moderator. The final 1 minute is for Engineer Githinji from Rumuruti.
Moderator, sir, and the court, I stand here on behalf of the Rumuruti PCA Hospital, which is upcoming. And basically, this report is much more for this section because this hospital started after the Health Week last year. But because it's a new entry, we need to acknowledge that already we are in this space. And so basically, I'm just doing a report to just have a preview of maybe where we are. We have an interim board that I am currently sharing, and it has 11 members that are already there. And to start off this hospital, most of the support came from the MBF, which gave us about 3.1 million. And this is what we used to do the construction of the facility, the small space that we are using at the moment. And shortly after the health board, the hospital took off and we started operating. And there was a lot of support from also the other sister hospitals, that is Kikuyu, particularly Shogori and also Tumutumu. And so for all the processes that we have been doing, that support is what has been sustaining the hospital together with the other one that we got from the MBF. I also want to say that together with that, we had quite a bit of government support. When we started, the officials of the ministry came and they pledged some support to the hospital facility, and a few things have been achieved on this area. Number one, they promised to supply power to the site. This has already been done, and the power has already been connected, supplied and connected. They also pledged to do a borehole for us. This again has also been done. And the other pledge that came from the government was the processing of the title for the mission land. And that again is still being done through the office of the minister for ads and through the CS Miano and that group. So again, we are grateful because that's a space that maybe we'll be able to enter pretty soon with the help of the government. Suffice to say that the operations are on, and basically for medicine and such, and also for the employees. That has also been supported by the 3 hospitals. We have 3 permanent staff. We have a clinical officer. We also have a nurse, and we also have somebody in charge of the records. And that support again has also been given to us by the 3 hospitals. And so basically we've been learning. On the day that the health board did the first camp there, we were able to see around 2,000 people. Further on this year, as a way of unveiling and also trying to lift up the read on the hospital, we also had another medical camp again, and we saw around 300 and something patients. And so the process of registration is what now maybe is hindering us, because we have a business name, but we needed to have that registered. We are being supported by the ministry in terms of now getting the other registration. Kenya Medical has given us a letter of no objection to run the hospital, but without a business name that is registered, we are not able to proceed to the next stage. But we are prayerful that that will come to be, and the hospital will continue to grow. Thank you, and the Lord bless you. Thank you so much.
Thank you, Moderator. With those reports now, we will have our chair to second the report. Chair.
Moderator and the whole session. Serving the Lord is like walking on, striving on a hilly, slippery ground. Sometimes it could be winding and rocky. However, we are determined to go. Therefore, after all the experiences, multiples of experiences, the Health Board expresses its gratitude to the Almighty God for His abundant blessings and divine guidance throughout those multiples of experiences. And the board remains committed to faithfully fulfilling its mandate and call as outlined in the practice and procedure. You know what? Come death, come life, we are determined to serve the Lord no matter what. Tumesema hallelujah na amen.
Do you second the report?
After the short homily, I, Jesse Masharia wa Kamau, do support the report given. Signed.
Thank you. He seconds the report. Thank you. Thank you. Thank you. You can take your seat so that now we can clap for them. We can have questions now. We are done. We can have questions now. I don't see any here. I see one here by Dr. Karanja, one Levin Moura, and so on. Okay, Dr. Karanja goes first.
Thank you, Moderator. I want to thank our hospitals, the hospital board, for the great job they are doing, and even keeping our mission hospitals afloat. We also want to thank God for the Rumuruti Hospital. But I have a question on Rumuruti. While it is a very good idea to start the hospital, was it sanctioned by the business committee? If it was, how comes it was not in the report of the clerks of the assembly? If you read and you look through the powers of the board, it does not give them the power to begin a hospital, but to supervise that. It is in PNP, Article 16. The other aspect, the money to start the Rumuruti Hospital. Here MBF brought the money. Did it pass through the finance committee? Did the board, if you read in the powers of the board, doesn't have the power to raise that money to do it. So while it's a good thing, because having a fourth hospital, those sides, is a great thing to do it. But also it's also important, Moderator, to take care of our processes. Because if the processes are not okay, tomorrow something else will happen that may give us trouble as well. I hope I've been heard.
Question, you have heard it.
Thank you.
Next to you, Levin Moura.
In support of what Reverend Karanja have said, we have a hospital in Kamboi, a very old learning hospital. It has never been mentioned, but now there is a big hype of a new hospital in Rumuruti. My question is, the new CAM hospital that have been sanctioned by the board illegally, because they have no powers to do that, why then do we not hype Kamboi, which is one of the oldest hospitals that have been running for years in this church?
Next question, Everdoria.
I think my question goes to but more specifically to Mutomo. There is a satellite clinic at Karatina. And then within its life, on 7th May of 2025, a new entity was registered that is not registered at the it is not registered as PCA. Things are registered as at the PCA Foundation, the Presbyterian Foundation. Rather, it is registered in the name of the CEO, Hudson Kenywa Justin, and another person who is not even a member of the board. You go through the board of Tomotomo, and she is not a member of the board yet. She and Hudson, the lady is Gladys Wajiko, they registered an entity. It was registered on 7th May 2025 within the life of the satellite clinic. Why did we need this registration, which is done outside the church structures? Who authorized it? And where are the accounts for this entity? Thank you, Moderator.
I see no other hand. Therefore, responses. Maybe I could ask Kikuyu Hospital, how much money are you owed? And by the rate NHIF and by SHA.
Okay, thank you. Moderator, I want to respond. One of the first things that Moderator, the GAC needs to know is that Reverend Dr. Karanja is a member of Health Board. And therefore, he's the one who has processed this report himself. And therefore, he still can also participate in helping us in responding. For sure, Moderator, without making any joke, we as the Health Board did all our minutes and the processes to begin the hospital. Probably if like Reverend Karanja is bringing out, if the health board doesn't have this mandate, I had this GAC to approve what the health board did in good spirit. On Kamboi, I would want to say that we have several layers of hospitals. We have hospitals at the national level, and we also have hospitals owned by other entities, by the presbyteries, by the parishes, and by the congregations. PCEA Kamboi Hospital. Well, I was there during their latest event to relaunch it. It is not at the national level. Just like we have other hospitals like Nakuru West, Kayole, Honi, and others that we do not bring them as we do our report. I am very sure that when the presbyteries are receiving the reports of their parishes and the presbytery, they receive these reports. On the registration of Tumutumu Hospital, I would wish to bring to the attention of the GAC that all the matters regarding to the beginning, to the funding, and to the opening of the Karatina Satellite branch was a strategic move by the PCEA Tumutumu Health Board. After the level 5 hospitals were disallowed to do the first entry of patients, and therefore we had to strategically come up with a branch that would receive first-time patients and also capture the market within Karatina town. And we have sufficient minutes and resolutions of the PCEA Tumutumu Hospital Board where I sit in regard to the opening of PCEA Karatina Hospital branch. A technical issue came in the registration, and the board, Monitor was able to review that, and the process of correcting is being done. When the registration, just like we have earned from Rumuruti, you will not be allowed to run a healthy facility without the registration. So the officer who was given the responsibility to do the registration just give the name of the CEO and the name of the officer from Tumutumu Hospital who was charged to oversee that facility. That is Madam Gladys, who is one of our senior staff in Tumutumu Hospital. I would want to assure the GAC and the PCEA that there was no intention whatsoever to use PCEA Karatina branch to swindle any money from the church. The accounts are being ran by the officials who run the accounts of PCEA Tumutumu Hospital. And that matter of correction and the legal officer is with us here is underway again through the processes and the minutes of the PCEA Tumutumu Hospital. On what amount Kikuyu is owned, the CEO Kikuyu would be the best to respond in terms of those figures. Thank you.
Thank you, moderator, sir. In terms of the NHIF, the amount owed to Kikuyu Hospital is 382 million, and that system was closed. And it's not just for Kikuyu Hospital, countrywide. So we are unable to access the system currently. SHA, we are owed about slightly above 400 million. So if you add, you can say we are owed about 800 million currently. Thank you, moderator, sir.
Thank you. Yeah, it's good that you hear those figures, because government comes to you with handouts, telling you how magnanimous it is. Yet you hear. I don't know whether you need that money. I don't know whether it's money you need.
Monitor, we really need all that money, and if there is anything that this GAC can do to ensure that we get that money, because we are in the land of the president, probably we can get it before we go down. We would be very grateful.
Great. We could send two of you across here to Sugoi and attempt to see whether that's, but it's good to hear when we speak sometimes in the media that SHA has a challenge. we are not exaggerating things. Because now, as you hear, NHIF, which they appear not now to care what it owed less to the hospital than what now SHA owes, yet it was launched the other day. Those figures are frightening. So these are things that concern us whenever we engage government, whether formally or informally. We are done with the questions. Can we get any comments? If they are there, Victoria.
Yes, my comment is that I want to thank the DSG for answering that question. But we must not be casual with how we deal with our things, because how we register things is through the Presbyterian Foundation. If we allow individuals, whenever they have a challenge, to go and learn and register a small company, and we have several, Mr. Moderator, registered by individuals, but yet they run under PCA, that would be very dangerous. For example, in that answer, there was already the clinic running. This was registered within the life of that clinic. So that answer, though unsatisfactory and taken by me, is a casual answer, and we must not deal with our matters casually. We are dealing with an institution that will live longer than us. Thank you, Moderator.
At the back, Elder Muraya.
My name is Peter Muraya from Pwani Magharibi. My comment towards the registration of the said hospitals like Rumuruti. I have heard that they have the government have injected money, and if I'm not wrong, even the opening was done by the CS, not our moderator. And when the government comes in, because we had many challenges with our schools, we are aware, where we have fought a lot with registration. When the government have brought in money to help us, my advice is, let us be very careful where we bring the government in when we are not even registered. We can be able to look for partners or do it ourselves. Thank you.
I'm sorry, Moderator, that some of us would seem like you're talking more, but when people are not talking, that's why we're in a GAC, that we deliberate. My comment, Moderator, will be on that matter of how a hospital, national hospital, is begun. Because ordinarily we would expect it to be in the clerk of the assembly report. For future, many other generations will come around here. And if people again, another board starts and does their own thing, we'll find ourselves in trouble in years to come. So I would wish either we find a way of ratifying that. Is it just a comment that we find a way of ratifying or sanctioning the Rumuruti Hospital so that it is procedurally well in our records for now and in the days to come? Thank you, Moderator.
Moderator, I thought that the DSG was asking for permission from the GAC that we establish a Rumuruti Hospital. I don't think, he said, I don't think they followed the procedure. And now he stood and said Karanja is part of the board and he knows they are supposed to come and ask this GAC to allow them to establish a hospital. I think like we are being hijacked to agree we have a fourth hospital that maybe if it was not sanctioned by the business, and if it was, it is not in the clerk's report as he says. So now the next GAC will be having reports of another fourth hospital which was not sanctioned to be started by the church, because as one of our elders have said, even commissioning of the hospital was done by the CS Aden Duare, who even mounted the brigade with a kofia. So we are wondering, is it a government hospital? If it's a church hospital, can we go? Because the board has no, in Acts 16 of the Herald Board, they have no mandate to start a hospital. That is the act of the hospital, or the act of health board in our PP. They don't have the mandate to start a hospital. There is nowhere they have a mandate. Them is to supervise and manage the hospitals. So they have taken down the powers to start a hospital, manage the finances out of the finance committee in the head office without the authority of the church. So this hospital, next GAC will be having reports. Who sanctioned? Who allowed it to be started? Who is managing the finances that are coming from this international organization? Who is managing? Who are the board members? Who sanctioned how the board will be constituted? Because there is a board, and I thank God for my good friend, Engineer Githinji, who is the chairman, and I really honestly have a lot of integrity. But how is that board constituted? It's a national hospital, yes. National means it belongs to all of us. How is that board constituted? Who allowed that board to be constituted? So we are not in the right, we are not following the right procedure. Before we accept as a national hospital, the right procedure and systems must be followed. And I repeat again, Act 16, they have no mandate constitutionally to start any hospital in the country.
Okay. Those are the comments. Karigido?
Thank you, moderator. My first is to congratulate the 3 hospitals in terms of the work that they are doing. But I think it's important that we also address ourselves to the challenges that the institutions are facing. And I think this also accumulates to what our major challenge is. You look at from the audited account that have been shared, Kikuyu Hospital has done a turnover of about 1.5 billion shillings with a surplus of 33 million shillings. Again, you look at the accounts receivable, you have 921 million shillings accounts receivable. That could be the money that are expected from NHIF and SHA. And obviously there could be other creditors because that is totaling to about 800 million shillings. Go to Tumutumu, they do a turnover of 555 million shillings and gave us a surplus of 7 million shillings. Again, we have account receivable of 382 million shillings. If you look at if you just take the percentages, and you've got a number of accountants here, you can be able to work around it and you see where the challenge is and where we are facing the kind of challenge that we are facing. Lastly, Chogoria Hospital with a turnover of 712 million shillings, giving us a surplus of 100 million shillings, commendable even if you look at last year. But again, you look at accounts receivable, 441 million shillings. This could be amounts receivable either from maybe SHA or from NHIF. And this is really the major challenge that we are facing. And I think it is important that we address this in terms of the general issue of the debt situation that we are facing. Thank you, moderator.
Okay.
Thank you, moderator and the GAC. I think first of all, I want to commend the health board for what it's doing, and especially because of the Rumuruti facility that we are talking about. I think yesterday you heard, I come from the Rift Valley, and I'm one of the happiest people that we have the 4th hospital in the Rift Valley. I think it is good for us to commend what they are doing and then give what they have done, the mandate, because we are the GAC. There is nothing else we are waiting from here. I want to make a proposal that we give them a go-ahead to continue with the 4th hospital from the floor. Thank you.
Okay. I think the best procedure is that report to come to the business committee so that the business committee processes it, because in the clerks of the assembly, we didn't have anything about Rumuruti. So if it comes to the GAC and the business committee has not had time to interrogate it, we would be putting the cart before the horse. So even as that work is ongoing, the business committee needs a report from the health board about everything in regard to Rumuruti. Number two is, as was mentioned by an elder, we must be very careful as we relate with government. We know what is happening to our schools, as the elder mentioned, where government came in late, became our partner, but then gradually it takes over. I don't know, you know how challenging it is even to have a head teacher or a principal from our denomination in our schools. You almost have to plead with the TAC, and sometimes they tell you no. You tell them 2, 3 names, they tell you no. Eventually they bring you a principal you did not even imagine could learn in your school, and they know you will make noise for a while, and then the principal will be entrenched. So, well, we must be very careful so that we don't commit our institutions to government. And remember, even the community around there is watching. The moment they know taxpayers' money has gotten into that institution, sooner or later they will say haki yetu. They will say this is not a church institution. It was done by taxpayers' resources. We know places, schools where we thought they were schools, but later on things went wrong, like in Pwani. So we must be very, very vigilant, even when it appears like the government is benevolent, that sometimes we could be entering into a trap that will haunt us in the days ahead. So those are the 2 issues I would advise the board to take charge of. The issue of Rumuruti, let a report be done to the business committee so that the necessary blessings can be given. And number 2, let's be careful, not just for the health board, but all of us, whenever we have anything that we are doing. You have heard how much they owe us. If you do your calculations, it's now 1.3 billion. Out there, the hospitals are struggling. They pay salaries on overdraft. Some of them, they can't. Shokoli is complaining about dilapidated buildings. They can't do a facelift of those buildings. The suppliers are hard on them because of this money. So we must be very keen to assist and to do what is right. I guess with that then we can get to... Yes?
Sorry, Moderator. I'm trying to listen to the report of Rumuruti, and I've perused through the document on the presbytery indicating that they started the hospital. It is under the management of Kikuyu Hospital. And I'm wondering, we've received finances. Where are those finances? Who is managing those finances? We saw on an update the CS giving out money, but possibly we need an assurance as we await the formal report. An assurance, where is that money? Which bank account is that money being administered from?
Okay, maybe as we get to the resolutions, that can be answered also.
Thank you, Moderator, and the GAC. I would want to assure the GAC and the church once again, and I would, Moderator, invite the members of this GAC to be a bit appreciative of the efforts being done and make corrections with love where we may have an oversight. The onslaught by some of the commissioners here, Moderator, is not warranted. PCEA Health Board has not killed anyone. PCEA Health Board, Moderator, is in the process of doing part of which is its mandate. Well, we are being rent to the PP that we do not have any mandate to begin the hospital. Moderator, if we went into that direction, there are many things that we will say that even at the parish level, we do not have the mandate because it is not written outrightly in the Constitution that one of your mandate is to begin a church. We may not find that in our Constitution, yet that is our mission. I want to assure you, moderator, and this GAC, that the health board will do its effort to do everything to align our activities to the laws of the church. Our resolution is being checked for me because I'm told, in fact, we have a resolution to that effect. It is being checked. If it comes, moderator will beg that I will read that resolution when it comes. But I would also want to say that the monies raised from our partners, the monies given to us by the government, and any coin that has come to the PCEA Rumuruti Hospital is being held in a PCEA Rumuruti Hospital account. PCEA Rumuruti Hospital account. And we must say that, moderator, the issue of beginning Rumuruti Hospital is not a yesterday issue. It's a very old issue. The 3 hospitals who are here did a lot of their background work way before, identified Rumuruti as part of where they would do the hospital. What the current health board has done is just to implement what was already done by these hospitals. And it is important that we appreciate that, and monitor would want to discourage the onslaught and ask that we are kind to ourselves as we do these things. Resolutions.
DSG, onslaught is not an appropriate word because these commissioners are entitled to know what is happening in the church. That's why they paid a heavy cost to come over here. So anything they question, let us accept that that is it. Provided an answer is offered, we will not take offense. Provided an answer is offered. So let's be civil.
Thank you, Monitor. Resolution number 7815 of the 19th to 20th April 2022. This GAC, this is document 13 resolutions. This GAC appreciate the work already undertaken to establish a hospital in Rumuruti. Further, the GAC instructed the health board to put all effort and move with speed and establish Rumuruti Hospital. Monitor, this is a resolution of this church.
That's a good answer. That's what the members are asking for.
Monitor, the spirit of the members was not correct, and that is why I thought that it's important for us to be able to check and put things right, because sentiments given to us about Rumuruti have not been kind, Monitor, from the word go. And we wouldn't want in the floor of the assembly to say some of the things that have happened in relation even to monies, in relation to Rumuruti. And the HT is aware of the pain we went through as we began. Some of us put in our personal money, moderator.
Thank you.
To this. Resolutions, moderator. This GAC receives the report of the health board services together with the audited accounts with the thanks. Further, the GAC appreciates members of the health services board for their continued commitment.
Taken.
This GAC notes with much appreciation the continued support by Medical Benevolence Foundation, MBF, and other partners in support of the health board programs.
Are there other partners maybe you could name other than MBF? Of course, we know what it's doing, but those other partners, if we would know them, we would want to recognize their effort.
Monitored through our hospitals, because it is health board. We have many partners that work with our hospitals. If we would ask, we can be given a few.
Is the list address?
It is not address, but they are many, including USAID. Other partners of health board are many, moderator.
Yeah, because it's always good when you mention people by their name. When they receive your gratitude, they are very excited that we have been thanked, we have done this and that. So much as the resolution is light, one by commending MBF, but if it is possible to also get the list of the others. Are they working with the hospitals? Could you get a list and we add them? It will be additional to that resolution. And with that addition then, the resolution is in order? Is it a good resolution? Yes.
This GAC calls on the church to persist in its advocacy for the payment of the pending NHIF share claims owed to the 3 hospitals.
That's a good resolution.
This GAC implores the church to authorize the registration of the 4 hospitals as separate, distinct legal entities, a crucial step that will enable them to individually apply for tax exemptions provided for under the Income Tax Act, Charitable Organizations, and Donations Exemptions Rules 2024, thereby safeguarding their financial sustainability admission.
I hear some disquiet. Let me hear. Why no?
Moderator, sir, I would prefer that we refer that matter to the business committee. That particular resolution and that particular matter to the business committee. Thank you, Moderator.
Yes.
Moderator, allow me to say this is very unfortunate that when we are dealing with very sensitive matters, we are always referring to the business committee. We are going against the spirit of Presbyterianism. The GAC is more superior than a business committee. Without remembering what happened yesterday, GAC is more superior legally, more than a business committee. And a decision made by the GAC, we can only, the business can only refer matters to the GAC, not the other way around. We keep referring things to the business committee as if the GAC is more superior. This is my comment on the same statement.
I wish to give guidance that, take your seat, that the business committee is an arm of the church and it can be a clearing house for us. Because sometimes since we meet once in a year, in the meantime, if you want clarity over matters, where do you want to set them? Would you say the GAC will take time to study that matter while we are still here? I think that's why the business committee exists, provided it undertakes to report to the GAC and the GA, because it does not always report to the GAC. There are times that it reports to the GA. If there is an issue that is handled by the business committee on behalf of us, then it is appropriate to do that. But we can't disregard what the business committee ought to do to help the church, because it meets regularly in the course of time. So I hope I'm guided properly, so that again you don't dismiss the role that the business committee will play in matters that concerns the church.
That resolution is taking away our hospitals from our hands to become independent. Because they are saying they want to register the hospitals in separate away from us, the church, which we represent in this GAC. So if the business meets and agree on that, and here the GAC will meet in the GA, we need to debate on that, not sending it back to the GAC, to the business committee, and say, how do we release our hospitals that are owned by us, the PCA, from the Presbyterian Foundation, and make them independent institutions away from us? This is a clear taking away of the hospitals from our hands, and as we sit here on behalf of the whole church committee, it is to say, let the hospitals remain registered. I know there is the issue of exemption of taxes. Exemption is very small things, Moderator. With a hospital that is making 1.2 billion shillings and giving us a surplus of a few million shillings. If they are collecting 1.2 billion, as Elder Kaligido have said, and the surplus is less than 100 million, what is the need of releasing the hospital again? I wish they are making 1.2, giving a surplus of 800 million. They want exemptions of about 200 million. Already we have issues. We are not going to release the hospital to be separated. That's my position. And we cannot send this decision to the business committee.
Information Moderator, so that I guide. Moderator, it is important that you help us to run this GAC so that it is beneficial to us. I wish that members...
Are you challenging my running the GAC?
Moderator, no. Moderator, I wish...
Are you challenging me running the GAC?
Moderator, I'm not challenging you.
Okay, then state your point.
Moderator, I wish that member would seek information. The report that we have given as Healthy Board, all that report is over 100 pages. We have summarized. The reason why we give this report to us is so that we can go through. So what we are giving here is a summary. Moderator, our thoughts and prayers to this GAC is, we have the same body that registers our property, the trustees and the foundation, as the ones who are the owners of the hospital, but each hospital be registered separately by the same officers and trustees who are the registrars of other Presbyterian Foundation entities. So we are not having other trustees or other directors. It is the same directors of the church, but to register Chogoria as Chogoria, to register Tumutumu as Tumutumu, to register Kikuyu as Kikuyu. So we will not have other owners. It will be owned by the church. But Tumutumu Hospital will be able to pursue exemption separately, because the things that Tumutumu Hospital do are different from some of the things that Chogoria Hospital do. And therefore, through that registration, moderator, the Kikuyu, the Tumutumu, the Chogoria will be able to enjoy the benefit of tax exemption that the church has sought for over years entirely, and it has not been able to get. So, moderator, I would wish that that member or any member sought information. How will it be done, instead of coming with a conclusion that there are people who want to steal the hospital from us, moderator?
I think in all matters, let us accept transparency. Let us accept to get clarity over every matter, because these are institutional matters. So when a matter is brought forth, I think there is no harm in seeking clarity, because eventually the decision we make here will go to posterity. So if we are clear on what we are doing, then we own the process. There is no harm in people asking questions if it's not clear to them and the clarity offered. And let's not take any offense when an issue is raised, because these are institutional matters. They belong neither to you or me. They belong to the church. And anything that moves our church forward is acceptable. Anything that adds value to our church is acceptable. These are institutional matters. And we are assembled here to ensure that those who come after us will say there was a GAC that dealt with such a matter and dealt with it prudently. So there is no harm in having these discussions. They are not a waste of time. They are very healthy. And they are invited and they are welcome. Thank you. Reverend Konyo, you had the mic.
Yes. Thank you, Moderator and the GAC committee. I think we are heading in the right direction, because clarity of issues is paramount important, so that we don't talk it out there, but in here. But my concern was that why is it that every matter we are taking it to the business committee, and the business committee is the operational tool for the GAC. We should send it for operation, but not for registration, because the registration is on this end. Why don't we execute all the matters here, and we are done with them, so that the business committee take its legitimate role to operationalize the resolutions. And moderator, sir, with all due respect, if the resolution that has been read after, if it was brought on board earlier, we wouldn't have a lot of that credit. I think if on your side you have evidences and those resolutions and anything that would help the GAC, before we put it on ignorance maybe, or out of concern, before we do that, from your chair, moderator, you can actually give information before, then we can now consume. Other than waiting, if you've already done a lot, then you say there is an issue here. Then you give the clarity. Should the clarity come first, or should it come later? Because the discussion, the spirit of the discussion is positive. Moderator.
Okay, I think I've allowed enough time for the discussion over that resolution. So maybe it could be read. If we agree on it, we take it. If we don't agree on it, we drop it. With the information now provided. Is that okay? With the information now provided, the resolution is read. If we feel that the information provided is adequate to pass the resolution, we pass the resolution. If we feel not, then we still have the mandate to. There are so many information, so I will make a choice of who will speak now. Dr. Karimi?
Moderator, that resolution is very important to the church. However, I'm asking myself a question. Isn't, in the light of all what is going on, even with the Presbyterian Foundation, wouldn't it, or maybe, isn't it time that maybe we think as a church of separating the investment arm of the church with the mission arm of the church, and both remain under the umbrella of PCA, so that we don't have to deal with the hospitals only. It's also affecting other institutions or other investments of the church. So my thinking would be that we think about investment in totality, not necessarily just about the hospitals, but have the foundation dealing with investments and separate it so that what happens in the investment arm does not affect the mission arm of the church. Thank you, moderator.
Okay, so what would be the best way forward now that we have a resolution touching on that? Or the hospital, not investments now. We are not, although it's an investment, but we are now dealing with hospitals. How do you go about it? Let's hear from Dr. Karanja.
Moderator, protect me from the voices behind me.
We were told our ears choose what to listen.
During moderator.
Proceed, you have the mic.
I would wish to say that when we deliberate at this General Assembly, representing a whole presbytery, what we discuss, with due respect to the Secretary of the Hospital Board, it's not an onslaught. Seriously, it's just good discussions for the growth and clarity of the church. No war, no onslaught, clarity. If we register the hospital, and it's a good thing, we need to be clear in that registration. Is it a company by shareholding? Is it going to be making profit? If tomorrow that company runs away with the hospital, what is going to be our take as a church? Because we need that clarity. It's true, as someone has said, with the time we are starting out to have, because of the foundation what we have, you want to go to a disaster, you can't even transfer any land. But then tomorrow, will also a presbytery come and ask that question? And moderator at the assembly, the GAC, I would want to say this openly. We had a challenge with IMIS. Is it IMIS or what? In our parishes, those that have rental facilities. And I know I was pushed by my parish trying to register a trust so that the trust can be running our property. And I kept on saying, no, we cannot do that. If now one entity goes, what will happen? Will another entity also decide, we are having challenges with the registration of our property, can we also do it? I don't want to refuse that is a good idea, but I don't understand what kind of a company that will be, what kind of a registration that will be, moderator. I wish there will be more clarity on the understanding of a company. Because tomorrow, we all know the General Assembly officials, will, even could the Secretary of the Board will not be here as the officials. They will be on this side. But I pray that we will sit on this side and say, that was a good decision we made 10 years ago, 5 years ago. That is my concern as a Presbyterian and a representative of my presbytery. Thank you, moderator.
Thank you, moderator. In my opinion, this resolution carries a very huge decision that requires that we fully understand it, and we also have all the details in form of a report maybe. So, moderator, I want to request, although we are saying we are the GAC, that we mandate the business to look into this issue widely, present a good report on the way forward without the details, so that our decision will not be based on anything we think, but on the good report, which will touch also on the other issues that we have talked about our entities. Thank you, moderator.
Well, I think that's fair, that we would want to pass a resolution well informed, aware of what we are getting ourselves into. We wouldn't want to pass a resolution that later on we ourselves regret, or even say, you know, by the time that resolution was passed, I was out. I was in the GAC, but I was out. You know, there are things that happen and you do not want to be associated with them later on when they have adverse consequences. So I would advise that we paid the resolution. The health board still can make a report now to the business committee. The business committee understands. That is why you'll never run away from these committees. And that's why they were formed, to help us, because they have more time to look at all those issues. Even if you are to put a rider that they will report to the next General Assembly, that's in order. But they are not there as cosmetic committees. This meeting will not happen until in another year's time. In the meantime, who does the study for us? Who crosses the T's and dots the I's for us? It is those committees. Therefore, I would advise that we allow the health board to give a detailed report now to the business committee. The business committee understands the entire report, interrogate it, and then the appropriate action be taken thereafter. So I advise we move to the next. We drop this one and move to the next one.
Moderator, as we move to the next resolution, as you have guided, I would wish to urge that because we have entities that have been created by this GAC, it is important that we appreciate that we have entities that have capacity. For example, moderator, in the year under review, Kikuyu Hospital is losing 212 million that would have been saved by the church, or there that registration we are seeking, that the same registrars of the church, the directors of the church, register for us. We don't want anything. Register for us an entity called Kikuyu Hospital. We have this year now lost 212 million. Moderator, we have dropped the resolution though.
Next one.
The last resolution, this GAC notes to the precision, the good work, commitment, and the dedication to service by the drugs desk outgoing director, Reverend Zachary Gioko Modinia. Further, this GAC wishes God's blessings to him in his new assignment and in future undertakings, and welcomes Reverend Kenneth Muigai, the acting director, drugs desk.
Taken? Taken? Thank you.
Thank you.
We are done. No, any additional? We allow for reports like this any additional resolution. If there are none, then we can step them down and clap for them for the good work. Thank you. Thank you. Thank you. Thank you. It is 11:13, so we'll be advised on the next order.
Moderator, I would propose that before we go for tea, we first of all take the minute books.
Okay, yesterday you are at arms, those in the business committee, that you wanted to submit the minute books, and we told you they are not submitted in the business committee. They are submitted at the GAC, and some of you are telling me that the weight is very heavy. We told you the cross is heavier. So the minute book is not heavier than the cross. So by that then, we now have at the point where we are going to receive, we are going to offload you of the weight that you are carrying. So let's get guided.
Okay, moderator, it is time to receive the minute books. We begin with this.
Oh, come on, commissioners, you can't just move out anyhow, like you have another commitment out there. If you are, remember, I get hard on people who just walk out. You know that. that I get very hard on people who just walk out, particularly if they do not bow, even when the president is in the house. So bow if you have to leave. You are permitted to leave, but bow before you leave. Okay, thank you.
We received the appointment committee minutes book.
Where are they being presented so that we are able to tick that it has happened? Appointments? Done?
Appointments committee, business committee minutes book. Business committee, health board, finance committee, Presbyterian Foundation, training and personnel development, communications department, women ministry,
I hear some conversations out there. Can you ask those people to either come in or go to wherever they were going?
women ministry, yes, here. Youth ministry, Christian education, children ministry, men's ministry, missions and BSR, we go to the presbyteries, Kaboi Presbytery. We are in the central region. Lemuru Presbytery, Kiamatare Presbytery, Githunguri Presbytery, Kiambu Presbytery, Ngecha Presbytery, Ngecha are not present, moderator.
Gesha, I see the moderator. How about today? We will follow up.
Komodai Presbytery, Alari Presbytery, Katondo Presbytery, Thika Presbytery, Theririka Presbytery, Eastern Region, Imenti North, Imenti South,
for a serene, affordable getaway in Mombasa? Welcome to Waget Hotel, a PCEA-owned destination where comfort meets value. Whether you're an individual, a family, or a group, Waget Hotel offers the perfect setting for rest, bonding, and fellowship. Enjoy our exclusive off-peak rates for PCEA church groups at just 2,500 shillings per person on half-board and 2,800 shillings per person on full board, inclusive of a complimentary conference hall. At Waget Hotel, we go further with special discounts, flexible packages, and rates designed with your convenience in mind. Experience genuine hospitality in a quiet, serene environment, the perfect place to relax, connect, and create lasting memories with your family and team. For reservations, call 0722 209 796 or WhatsApp 0731 209 796. Waget Hotel, your home away from home in Mombasa.
Kirimara East and Nanyuke Presbytery. Nairobi Region, Milimani North, Pwani Kati, Nairobi South, Pwani Kaskazini, Milimani South, Kajiado, Pwani Magharibi, New Nairobi East, Nairobi Central, Nairobi North, Nairobi North, Nairobi North. Oh, okay. Ngong Hills, Rift Valley Region, Nakuru East, Erbagon, Iriaini Presbytery, Kitale Presbytery, Aberdare Presbytery, Njoro Presbytery, Mutata Magumoni has come.
I also saw Gesha somewhere, so they can also submit.
Okay, Gesha. Njoro. Njoro. Okay, coming. Daragwa Presbytery. Nyahururu Presbytery. Sugar Belt Presbytery. Rumuruti Presbytery. Eldoret Presbytery. Nakuru West Presbytery. Nyandarua Presbytery.
check whether Doro, why? Is within here. Some worship in the meantime.
sisi tumesimama imara, mimi na nyumba yangu tutamtumikia Bwana. Hatutaacha Bwana aliyetuokoa, hatutaabudu miungu ya uongo. Yeye ndiye Mungu wetu wa kweli, akituonya tusimuache kamwe. Bwana ni mtakatifu, anataka mioyo ya uaminifu, tuishi kwake tukimwabudu daima. Yeye atabaki kuwa Mungu kwetu. Kama ni vigumu kumtumikia Bwana, chagueni leo mtakayemtumikia, lakini sisi tumesimama imara, mimi na nyumba yangu tutamtumikia Bwana. Kama ni vigumu kumtumikia Bwana, chagueni leo mtakayemtumikia, lakini sisi tumesimama imara, mimi na nyumba yangu tutamtumikia Bwana. Na kuiweka mbali miungu za babu zenu, geukeni mtumikieni Mungu.
Well done, well done. I better clap. For General. I guess there will be another opening for them to present. In the course of the day, Joe is not very far off from here. So I guess there will be another opening for you. And thank you for nurturing young singers in your meeting.
And bringing forth, thank you. And bringing forth the theme of the General Assembly very ably. Thank you.
I request the worship committee to come so that we can break for tea.
Naomba tukasimama ili tukaweza kuomba. Mungu wetu na Baba yetu, tunakushukuru kwa fadhili zako ambazo ni nyingi kila asubuhi. Asanti kwa umbali ambao umetuleta tangia asubuhi. Tunashukuru na tunaabudu jina lako. Tunatazamia ya kwamba utaendelea kutubeba hata kwa sessions zingine ambazo zimesalia mchana wa leo. Ni asante Mungu wetu, tunapoenda kufumukana, tuna kikombe cha chai na accompaniments nyingine ambazo tutakazo kutumia. Tunaomba Mungu katubariki na ukazitakasa ili ambapo tunapotumia zikawa manufaa katika mili yetu. Tunakuabudu na tunakushukuru tukijua kuna wengine ambao hawana nafasi ya kupata, pia au ukawabariki na wakofurahi ambapo wanapata cha kutumia. Mungu wetu tunakuabudu kwa maana umekuwa mwema tangia wakati tuliingia katika kikao hiki. Tubebe tu Mungu wetu ili sifa zikakurudia. Na ni katika jina la Mungu Baba na Mwana na Roho Mtakatifu tumeomba na pia kuamini.
Milele Kak drinking water is the real deal. Now in a brand new look, but still as sparkling as ever. Trust us to quench your thirst. Grab your bottle from a shop near you now. Place your order by calling 0725-253-777 or 0738-225-966. Milele Kak drinking water. Drink fresh, feel Milele.
Welcome to Mono Safaris Tours and Travel, where you discover hidden gems with our exclusive low season tours. Escape the crowds and experience the beauty of travel during the enchanting low season. We invite you to uncover unique destinations at unbeatable prices. Adventure awaits with Mono Safaris Tours and Travel. Embrace the extraordinary during the low season. For more information, visit our website www.monosafaris.com or call us at 11504807 or email info@monosafaris.com. Mono Safaris Tours and Travel. We are because we love what we do.
Looking for a serene, affordable getaway in Mombasa? Welcome to Waget Hotel, a PCEA-owned destination where comfort meets value. Whether you're an individual, a family, or a group, Waget Hotel offers the perfect setting for rest, bonding, and fellowship. Enjoy our exclusive off-peak rates for PCEA church groups at just 2,500 shillings per person on half-board and 2,800 shillings per person on full board, inclusive of a complimentary conference hall. At Waget Hotel, we go further with special discounts, flexible packages, and rates designed with your convenience in mind. Experience genuine hospitality in a quiet, serene environment, the perfect place to relax, connect, and create lasting memories with your family and team. For reservations, call 0722 209 796 or WhatsApp 0731 209 796. Waget Hotel, your home away from home in Mombasa.
At Presbyterian College Rubate, each program is designed to combine academic knowledge, practical training, and strong moral values to produce graduates who are ready to serve and lead with excellence.
I am in second year, term 2. I have been in Rubate for around 5 terms now, and it's a student-friendly environment. It's a school where we offer 3 courses: diploma in primary education, diploma in nursing, and diploma in HSS. Diploma in education, it's a course that takes 3 years, 2 years in school and 1 year in practicum. The reason why we are in Rubate, it has a student and friendly environment. It is a school that is based on Christianity. And another thing, it is a school that it is well known for its good results. And students from this school have alumni and you have seen them going far. So it is a school that is well known. We can encourage other people to come and join us because we have seen others growing and we want to grow all together.
My name is Isaac Mudhomi from Presbyterian Teachers College, Rubate. This is my second year in this school. And one thing I can say is that the school is friendly. You'll enjoy staying here. We're offering different courses. We have diploma in primary teacher education. We have diploma in health sciences. And we have diploma in nursing. So one thing about this school, it's a God-fearing school. So you can be sure your kids will be well taken care of, and they'll come out of this school knowing God, and that will be a good thing for you as a parent, because it will help them even in life to make the right decisions. Another thing about this school, we have very friendly tutors and other staff members that help us and nurture us in day-to-day activities. So it's a nice place to be, and I'm proud to be here for honest service.
We want to say that Rubate being a Christian college, our strength is actually to make sure that students here are not only taught to become professionals, but we take time to nurture their spiritual growth in ensuring that we have enough programs to ensure that they participate. A case in point, every Wednesday we have what we call college worship service, where all students, staff, and even visitors, if there are any, are supposed to attend a service from 10 to 11. We also have Bible studies every Thursday, so that our students are also taught the Word of God and they also learn from others. On Saturday, because we have quite a number of SDA students, we also have a service, and we also have a service on Sunday. This is to make sure that all students who come in our college are taken care of spiritually.